patients seeking emergency care in parts of England are being forced to wait 15 hours on average for treatment in A&E or for an ambulance. Hospital bosses have responded by blaming a combination of bed blockers, COVID and flu, and several NHS trusts have declared critical incidents, which means they are struggling to provide safe care. To break all of this down now for us is GP at Same Day Doctor, Dr Laurence Gerlis. Dr Laurence Gerlis, thank you very, very much. So waiting 15 hours in A&E is an absolute monstrosity. Why is this really happening?
Well, I think to some extent what the NHS has said is true. I mean, we've been overwhelmed. I've just been working 10 days in a row non-stop, dealing with coughs, colds, COVID, flu, chickenpox, sinusitis. It's been the worst winter that I can remember. I remember saying the last 2 winters I wasn't seeing any of this because we were in lockdown. And it's we do have this immunity deficit we've built up. I know it sounds controversial, but there's no doubt it's true. We were all locked down for 2 winters. We are getting 2 or 3 times more of these infections. Almost everyone you meet, everyone you talk to, has some sort of respiratory infection. So to me, that's the number one cause of all this. Secondly, add to that, we always have a winter crisis anyway, because the NHS works at 99% capacity, so there's no spare capacity in the winter. Thirdly, we do have a breakdown in social care, so that bed blocking means you can't discharge patients from hospital. So I think all those excuses actually are perfectly valid. And when I look at social media today, I can see the system, even everyone now admits the system is broken. It's not breaking down. It has broken. This is it. This is the point that we said would happen. The system has totally broken down. You can't get an ambulance. Patients waiting 12 hours in A&E. It's pretty, and it saddens me to say this. It doesn't please me at all, even though I'm not in the NHS anymore. It saddens me enormously because I believe in the principles of the NHS.
Yeah, but do we have to wake up now and realise that significant, serious root and branch reform is needed and maybe slaughter what was once a sacred cow that has turned into a fatted calf?
Yes, we do, Patrick, without a doubt. But I don't believe there is a politician who is capable of getting this through. The public will not allow that.
What needs to be got through? What is it?
Yeah.
Just specific. What is it that needs to be got through?
We need to have an insurance-based system like they have in Australia and most of Europe, where people who can afford it are insured through their work. You have exemptions for certain people, limited exemptions, maybe for the under 6s, the over 70s, rather than the broader exemptions we have in the UK for prescriptions. Limited exemptions help from charities for people who really can't afford it, but basically a fee-based system where you have to pay, as you do in Ireland, you have to pay to see a GP and you have to pay to go to accident and emergency because the demand has spun out of control. You were talking earlier about the breakdown of the nuclear family. This is another issue, breakdown of society. So people can't get advice from, helpful grandmothers who know that not every feverish child needs to go to hospital. So all of these things have come to a perfect storm and caused this complete breakdown in the system.
But the big argument against it, and the thing that would make it so unpalatable to a lot of people, and the reason why I suspect politicians don't have the bottle to say this, is because as long as people would be able to point at the poorest or most impoverished or the most vulnerable in society and say that the thing that you have just proposed here would make them less well off in terms of healthcare, they would get worse healthcare, then it wouldn't be done. So would those people in society have worse healthcare as a result of what you've suggested?
I've got 2 answers to you, Patrick. Firstly, that has always been the argument against it, but right now, those same people, are not getting any healthcare anyway. So that argument breaks down because the most deprived people in society cannot access healthcare. And so whether they're worse off under a fee-based system doesn't matter because they're not worse off, they're as bad as they are now. The second point is, I believe it's up to the medical profession to take control of this. I engage with a lot of doctors on social media who always criticize me for saying a fee-based system. But they all think it's very unfair. And yet, GBNews put out a tweet a few hours ago that a lot of doctors are emigrating to Australia. And one of your colleagues quite rightly pointed out, hang on, the same people that won't accept a fee-based system here are emigrating to an insurance fee-based system in Australia. So they don't have a moral objection to it at all. They just don't want to see the UK adopt that system, a system that would work. It would raise money for the NHS. It would decrease demand to a level that everyone could get the access, including the poorest in society, because we could help them get the access. And if this isn't done soon, we're going to have winter after winter. This is just going to go on for a long time.
Yeah, absolutely. Dr. Laurence Gerlis there, thank you very, very much. GP at Same Day Doctor, just filling you in on exactly why we are seeing things like 15-hour waits at A&E now, people unable to get an ambulance, and crucially, what needs to be done about it. However unpalatable it will be for a politician, he is saying that he thinks we need an insurance-based system, and he makes the point, and I suspect depressingly we are in this situation right now, which is if your quality of healthcare is already so appallingly bad, do you mind changing the system, even if it means that some people who are at the lower end of, let's say, the economic spectrum or the societal spectrum whatsoever, just continue to get poor healthcare? It's already bad, isn't it? I don't know. That's a very controversial view. What do you make of it? GBViews at gbnews.uk. But on that, actually, loads of you have been getting in touch with your thoughts on NHS waiting times. Who is to blame for 15-hour queues? Tony. This is Tony, who's a radiographer, actually. He says, in my opinion, it's partly down to most people not knowing who to consult. Is it a pharmacist, a GP, full A&E services? The difficulty accessing GP services is creating a dependency on hospital A&E services. And in many cases, the A&E doctor is doing the job of referring them to a specialist, which a GP could do. Yes, I mean, obviously, I defer to your greater knowledge than me. You appear to work in the NHS, Tony, and it's fantastic insight, that. And it's something, I think, that we've always suspected is happening, isn't it? Also, as well, people probably presenting themselves at A&E when they just don't really need to, full stop. I can't help but wonder if that is an issue. But again, that's a tricky one, isn't it? Because you don't want to deter people from going and scare them off going when actually they do need to go. That's the knock-on effect, isn't it? But look, thank you very much. Loads of you have been getting in touch, not just on that, but on the main issue of the day as well, which is that taxpayers' money has apparently been going to the Prevent scheme. The Prevent scheme in itself allegedly has been just dishing that money out to people who actually support things like, oh, I don't know, the Taliban and radical Islamist clerics, etc. So it doesn't appear as though, for want of a better phrase, the taxpayers getting a lot of bang for their buck.